I think a lot of times it's a culture shift, right? And culture starts at the top. It starts with those who are in the boardroom, who are in the C-suite. So the transparency, right, with the information as much as you can, that builds the trust. Um, Having that change management team showing that, you know, people on the ground floor, they won't lack control. They have representation, right? Everyone wants to be heard. People don't want to feel invisible, especially in the age of technology. They want their voice to mean something. So whether that's having representative for them and their department, I mean, that that's also really helpful. That emotional side of it can speak volumes if a person feels unseen and unheard.
Welcome to the Bedsides and Boardroom podcast, where we speak about the intersection between business and medicine. Today, we've got a very special guest and a good friend of mine, Dr. Toni Zink, that is here. Thank you very much for joining the podcast.
Thank you so much, Nathan, for inviting me. This is fun.
So today, we're going to be speaking about change management. And I had a friend, she did a business degree. Her first job was to be a consultant, and she worked at a bank in South Africa. And she came home one day and she told us about what she did there. And she said she did change management, and that was the first time that I'd ever heard this term, change management. I was working for the government at the time, and what we just did is we just wrote policies and we just expected them to be done. Now, we didn't know that you need to manage the process between making a decision and until that change is actually made. So if you can just tell us a bit about what change management is.
Sure. So, especially in healthcare, change management is really transitioning a team or a group of individuals through a structured process from one state to a desired state. So, let's say you're adding um, something new, like a new thing to your organization, um, and you want to minimize disruption. You want to maximize the impact of what you're gaining in this new thing, whether it's a new electronic health system or new leadership, and you want to get your team from point A to point B. So change management is the process you take in order to get from point A to point B. And it's really about the people involved, your employees, because you want to support them, you want to equip them for success for this change that's about to happen.
So you've had a quite an interesting career. You've worked both in the kind of medical side. You still see patients at the moment. Started your own, you started your own business, and so just tell us about your career so far and what brought you to thinking so much about change management.
Sure. So I'm a physician by training, family medicine specifically, and I've been doing that for almost 2 decades. And within those 2 decades, for over a decade, I've been in the healthcare management arena. So I've been able to see small organizations and large and medium-sized organizations go through changes. And I've seen it done well and not so well. And so for me, it's always about the employees, right? So my colleagues that I'm working with, how they dealing with the change, and also the patients, because at the end of the day, whatever you're implementing is going to affect the patient. So it ultimately led me to think about how to best ease that transition because no one likes change, but it's
Yeah,
inevitable.
but you've also worked a bit in the boardroom.
Yes,
And,
yes.
that's not maybe the patient facing.
hmm
And what kind of challenges have you seen from that aspect, kind of the manage it down kind of aspect, that you've struggled with in the past about change management?
I think one thing is expectations, right? So in the boardroom where the decisions are made behind closed doors, um, you put together a strategy, you're looking at the budget, you're looking at the numbers, but having realistic expectations of how that translate on the floor, I saw that as challenging, right? So we can have a strategy that we know is going to increase our revenue by a certain percentage, but how does that affect the actual operations on the ground floor for the nurses, for the reception staff, for the physician seeing the patient? So I've seen like a disconnect between those things that can be challenging. I've also seen resistance to change, right? So in the C-suite, a strategy is made, sounds great. We're going to implement it on the floor, and then you get resistance from your employees because they might not understand the big picture, right? They're only seeing it through a one lens, a tunnel vision of what that's going to happen and affect their job. So it can be on both sides. I've seen it on both ends, especially during COVID.
What were those challenges that you had during COVID?
Oh my goodness. We can build a whole episode on COVID. We learned a lot. We learned a lot. I
I think the
remember,
whole of the medical changed, and
yes,
the way that we did things before.
definitely. I got a job change because of COVID. So I was just watching things unfold at the very beginning of COVID, and I had some ideas, I had some critiques. And I remember I went to the boardroom. I was a physician, I wasn't a medical director. I went to the boardroom and I talked to the COO, so the director of operations, and he was like, "Oh, come tell the CEO." So I was invited to a board meeting, and they started speaking to me like I was the medical director. And the CEO, he gave me my first assignment. He said, "I need you to build a wall." I said, "A what?" So the first job as an incoming medical director was to build a hard stop for anyone coming into the clinics so that they would have their temperature taken. You know what I mean? Like a procedure to make sure that we were keeping everyone safe,
Mm.
and put people in place to do that. So it was all hands on deck. Right? So being able to take an idea from the CEO and actually translate that into a physical hard stop at the front of an annex, right, of a clinic, and then also put the staff and the manpower and get the equipment, right, to take, forehead temperatures, to do acute testing or whatever we needed to do. So yeah, it was a lot, but that was change.
One of the challenges that we have is that our patients also have first certain expectations. So whenever they come
Yes.
into and get a treatment from us, they have
Hmm.
expectations of how that's going to go. And I think
Yes.
a lot of that needed to change during COVID, where, I'm just speaking from the EMS side, is that our patients always expected just to be taken to hospital. That's kind of the end point of
Mm.
their interactions with the EMS.
Yes.
Whereas during COVID, we had to really say, well, look, you actually can't go to hospital now. You can't even go to your local clinic. You're sick, but you're actually going to have to stay at home. So I think that
Hmm.
is kind of a mind shift. So that's a great example of where things went well, is that you created this wall between the patients coming into the ED and then eventually on to the rest of the healthcare system.
Yes.
Tell me what goes wrong
Hmm.
when things are not as smooth as that.
Well, when things do not go well, um, and there's no system really in place for change management, then there's a lack of accountability, right? So then there becomes a culture of blaming when things don't go well. So I've seen that as an example. During COVID, we changed electronic health system for a mid-sized organization with over 200 employees. So imagine there's over 200 people that need to learn a new electronic health system. And it's not the change itself that people are fighting against. It's really this sense of questioning their comfort, their competence, their ease. Um, and that's the uncomfortable feeling. There's like this sense of loss. They're losing something by moving to something else. I felt comfortable with this old system. I knew how many clicks to make. I know where to get from point A to point B and how to take care of my job. But when something changes, it's a little tricky. So I've seen a lack of accountability. I've seen the blaming culture. I've seen people leave, right, when change management does not go well. I've seen people leave their job posts and want to do something different. What have you seen?
I come from a background in from the government sector. I mean, from
Hmm.
there to big universities, which are these kind of big, really slow moving um, organizations,
Yes.
um, government and university, and then from there to the startup space where everything is just kind of happening all the time and things are changing almost on a daily basis. And I
Hmm.
think what 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 I can see from the government side is that we used to make policies and we thought that policies were were it. That was all we needed to do.
Hmm.
Um,
Yes.
and I used to sit in policy committee meetings, management meeting, excos, all sorts of these funny names for all of these committees that we used to sit on, and we used to write the policies, and that
Hmm.
was it. It would go sits in a file, and there would be some attempt to follow the policy, but we never really actively managed that time between what was written down on the paper
Hmm.
to to the change that we actually wanted to see. So I think that, from what I've seen, is that there's that a lack of active management through the process. It's just kind
Yes.
of assumed that it's going to happen.
Right. I think you hit the nail on the head. There's a lot of assumptions, and then things get lost in translation. I've seen at the top where the decision is made, and they're just telling people what the change is going to be. But if it's not actively managed, right, like KPIs, things measurable that are put in place, then sometimes the change doesn't even fully occur. It
Mm.
just doesn't. Yeah, it doesn't happen.
And I think there's also a lack or feeling of lack of control when it comes to
Yes.
change, that things are happening around you, and you've done something in a certain way, you got good at it, and then
Yes.
you have to do it a completely different way, which can be scary and can, as you said, feel like you've lost that sort of sense of purpose that you had,
Hmm.
that you'd built up over a certain amount of time. So I think that can be difficult. So how do we manage change within organizations that
Yeah.
can produce the outcomes that we want, but also make the process of going from one system to the next as seamless as possible?
I like having clear priorities. I love transparency, even with the staff, um, and not just telling them what it's going to be, but being transparent about what are you measuring, right? What looks like success between the board and success to um, who's providing the care on the ground floor might look very different. So I think having that conversation is really, really important because it does set expectations, right? And then defining the ownership. Because, for example, when we change the electronic health system, who owns that process when it doesn't go well? Is there a project manager who owns it? Is it the head of IT? Is it the medical director? Who owns the success of that? So having that ownership is important as well. And then visibility. People need to see their leaders, right? You can't make the decision something's going to change and then hide in your office. You've got to be visible. You've got to be available, right, for the questions, for the doubt that comes up. And it's human nature because you're managing people, not just numbers
Mm,
on a sheet of paper.
mm,
Yeah. And then for myself, we made a change management team, believe it or not. It was amazing. So what I did is I chose a representative from each department because there were four clinics with several departments and over 20 plus providers. So there was like a spokesperson from each department, the head of the OBGYN department, the head of the pediatrics department. And that change management team, those leaders, we came together. So I was able to hear what the concerns were from those departments, and they were intimately involved in decisions being made and then going back to their departments and talking with their colleagues as well.
So in that example, referring to the wall that you had to build,
Yeah.
um, the barrier to entry,
Yes.
and what type of things were the members of your team, your change management team, what were they saying from the ground that they were struggling with?
Well, operations, right? How long does it take for a patient to walk through the door, get their temperature checked, answer the survey questions to see if they're at high risk for having COVID? That time between that process and them actually getting back to see the provider, because these providers were seeing patients every 15 minutes. So it needs to be a well-oiled machine. So they were concerned, okay, if my patient shows up late and you are holding them at the front door at this wall, for, 10 minutes or so, they're going to be late, once they get back to the nurse and get their vitals checked. So they're thinking in terms of operations. How long does it take? Can we keep this moving? How do we streamline the process? Streamlining.
Mm.
Yeah.
So obviously, in the medical field, we have different risks. We have, and all of the changes that we implement
Mhm.
have in the background this risk to patient safety. So, what are some of the issues that we can have around the risks in terms of change management that could actually be seen in terms of patient outcome?
So we can see a lack of return patients, right? If you implement something in your organization and you have not thought about the patient themselves and how it affects them, the patients might not return. They might not return to your care. We saw a lot of patients actually lost to care entirely and didn't go and see anyone. So patients with chronic medical problems had issues, right? For example, during COVID, people were stuck at home, but they still need to take their medication for their high blood pressure or diabetes, because if they don't, it causes, more risk for them. So we saw that as well. So in our patient numbers, their morbidity and mortality, their livelihood was affected by the changes we were making on the ground floor and in the boardroom. Um, so it's not just always about money, and the revenue that you bring in. It really does affect patient safety overall.
So, you have that loss of continuity of care, so
Yes.
that someone doesn't believe or wasn't treated well in your organization,
Hmm.
then you have that loss of not only the current medical condition that they've got,
Yes.
but then also that they're not following up with some of the other chronic um, conditions. So I think that that's something that is really unique to us in terms of patients being customers in some way.
Yes. Yes.
That not only are they not returning to us in terms of the business sense, they're not uh, participating in our organization. The human cost to it is quite extensive.
It is quite high. And I have an example here in Dubai. I was working for a clinic that has been in Dubai for over 30 years. And the owner sold the clinic. And you have patients that have been going to this clinic for 25 plus years. So it was under new management, and then there were new providers. So you can lose a significant amount of patients that way. Because if someone has been coming to you as a provider for 25, 30 years, there's a relationship there. They don't see you as just their doctor or their nurse. They actually see you as a part of their family because you're taking care of multiple family members. So I actually took it upon myself to call. I asked the owner for the list of patients, and to call the patient to see, are you following up with anyone? Even if you're not coming back to this clinic, are you seeing someone for your chronic conditions? Because that's taking that extra step. That's part of change management.
And there's a certain amount of trust that you have,
Yes.
that you build up. And as healthcare providers, it's very easy to lose that trust, and
Yes.
especially in the environment of with a lot out there online about, uh, you know, big pharma,
Yes,
how, doctors are being paid to give injections or give vaccines. And there's a lot of
yeah,
misinformation out there that
there is.
can deter patients away from the care that they need to get. And
Mhm.
I think there's a real human cost to that. I think also,
Yes.
interestingly, the field of medicine that you come from, family medicine, you see your patients throughout the course of their life.
Mhm.
Whereas where we in the more emergency medicine side, we see our patients, hand them over, and unless they are a patient that comes back and calls us a few times, we hand them over and that's it, and then they carry on with the healthcare system. So
Mhm.
the trust for you is much more needed than for
Yes.
us.
No, I
So
agree.
can you give us maybe another example? I always like the practical aspects of these discussions where things went right and when things went wrong. Is there another example that you've got of change management that went well?
Hmm. That went well.
Maybe go with the one that went wrong. An example.
Uh, okay, so when you have multiple locations, right, within an organization, this goes to the conversation of large versus a small organization. With a large organization, you're dealing with complexity. That's the biggest thing is making sure that across different layers, across departments, across systems, across locations, making sure everyone gets the same information in order to make sure it's successful. So I had to go to each of the four locations to make sure they each got the attention, their questions are answered, right? Um, those kinds of things, and being physically present and available for that. Whereas in a smaller system, it's more about resources. They have limited resources. And a lot of times there's an over reliance on very few individuals who are doing the majority of the work. So it's looking at the size of your organization and where the barriers are, and then putting your head together to try to figure that out. Large organizations, it's complexity. Smaller organization, it's the capacity, the limited resources.
Mm. And and can you step me through the process? So you've got um, something that you want changed in the organization.
Hmm.
Let's say a big organization, because let's make it as complex as possible.
Okay.
Um, we don't let you off easy here.
Okay.
So you've got this change that you want to make. How do you go about practically implementing that from I've made a decision that I want this change
Hmm.
till that it's actually being monitored and performing the changes being performed as it should be?
Hmm. Yeah, I mean, when you're at the drawing board, right at the beginning, you should be thinking about all the things that can go wrong. Because when you're implementing something new, it's not going to be perfect. Again, expectations, right? So before you even start to implement something, you start with what are the challenges you anticipate, right? So, of course, you want everything to be perfect and go well, but start with this can happen, that can happen, A, B, and C can happen. What do we do if these things happen that are realistically can go wrong? I've always been taught to hire people who are smarter than me, because they will push the boundaries. They're going to think outside the box. They're going to bring up the what ifs, and plan accordingly. So I like having those type of people at the table before I implement something, so that we can think of those things at the drawing board. What can we anticipate? How do we prevent those things from happening? Because no matter how well you planned, it's life and things will
Mm,
happen. And then once you're at that point, you've thought of things that can go wrong, you've planned how you want to implement this thing, then we've actually had to map out the process, to visually map it out from step to step, like you talk about, until you actually implement it. Who needs to be involved with it, right? We talked about accountability. Who's going to take charge of this operation? And it can be multiple people, but everyone needs to know what their role is and what's expected of them because you get a lot of gray area and then there becomes confusion and you want to prevent blame at the end of the day. And then having realistic timelines as well. Once you map it out, this is what I want to happen. I need A, B, and C so I can get to D. This is who in charge of A. This person's in charge of B. Then having a timeline on that and a realistic timeline. And we need flexibility because things do come up and things do change. That's one thing we did learn a lot a few years ago through COVID, is you've got to be flexible. So putting a
Mm.
timeline on those different aspects of what you're trying to accomplish, and then communication, right? One of the big things about change management is it's not just a exercise in communicating what needs to be changed. It's an operation. It's a full
Mhm.
blown operation with a project manager. But I feel like sometimes we miss one of those steps. We either don't put a realistic timeline, we don't communicate fully what to expect, or we don't put people in place using their strengths to be accountable for each step of the way in order to get to the final product.
And if you have someone that is really resistant to change, just don't want to to make a change,
Mm.
um, how do you convince that person that this is a good thing?
Oh, it depends on what their role is within this process. I mean, it's hard to convince people, but it takes a
I think
conversation, meeting them where they're at. What are they really concerned about? What's the underlying cause of them being resistant to the change?
mm, I think there's always two broad perspectives. You can either use the carrot or the stick, and
Mm,
I've always thought that the carrot gives you the opportunity to have a positive feeling
mm-hmm.
around what's going to happen.
Yeah.
Um, and then the stick side is just you can cycle of negativity,
Mm-hmm.
whereas the person doesn't want the change, and then because they're being punished for the change, they don't want the change even more, and it just spirals down and down and down. Have you found that it's better to try and penalize people, or is it better to try and offer them some reward for uh, positive change that they see?
I have not seen any results, good results from penalizing people when it comes to change. I've seen it difficult to convince people, and I've seen people very motivated by the carrot, but not by the stick. Not by. I have not seen that work very well, especially in my home country. That doesn't work very well. So there's some cultural differences you also have to look at. Um, but when people are motivated, um, some people are motivated by the mission. Whatever the mission and the vision is for that organization, they latch on to that, and that's all they need. That's all they need. Other people are motivated by, the revenue that comes from it, you know, or the incentive, the financial incentive. I've seen people motivated by very different things. So I think reading the room and having that honest conversation with whoever is resistant to it, that's important. It takes a certain
Mm.
vulnerability, I think, to get to the real reason. What do you
So
think?
obviously, change is an emotion. There's emotion that is connected to this change.
Yes.
So there's a lot that goes into the psychology of
Mm,
how to create that change, not just within that person, but also within that organization.
yes.
So, are there any other motivating factors that we can use to create that change?
Mm. I think a lot of times it's a culture shift, right? And culture starts at the top. It starts with those who are in the boardroom, who are in the C-suite. So the transparency, right, with the information as much as you can, that builds the trust. Having that change management team showing that people on the ground floor, they won't lack control. They have representation, right? Everyone wants to be heard. People don't want to feel invisible, especially in the age of technology. They want their voice to mean something. So whether that's having representative for them in their department, I mean, that that's also really helpful. That emotional side of it can speak volumes if a person feels unseen and unheard.
Mm. And there's also this personal element to it. And I
Yes,
think like there's a lot that goes on in people's lives that we don't necessarily see at the workplace.
exactly.
A family member can die. Like
Yes,
for my example, my wife is pregnant, so we our lives are just about to change. So there's a lot of changes that might be happening in the background that
yes.
can make it difficult for us to implement a change in the workplace because we want the workplace to be where we're competent, we know what's going on, things aren't changing. We've done this for a certain amount of years, we know how to do that.
Uh-huh.
Whereas when this massive change comes along, it can strip us of that feeling of control over the work that we
Yes.
do.
That's true. And feeling safe, right? I know this. I go to my job, I do it well. It's separate from my home life, whatever problems are there. Having that emotional intelligence is really important, especially in leadership.
So, what are the types of attributes of a person that would be good at accepting change or implementing change?
Accepting or implementing.
Both. Let's go with accepting.
Ooh, I think being able to hear a different perspective, right? So someone who's open to hearing other perspectives, because sometimes if you only have that tunnel vision, you only see things through your how it affects you, and you can't if you can step back and see the bigger picture, how it affects your other colleagues, right? That's important. So I think that would be great for someone who's accepting change. That emotional intelligence we just talked about, right? So when things don't go your way and change is happening, regardless of what you want, being able to deal with that in an emotionally intelligent way, being able to verbalize, right? Um, how you feel about a change that's about to happen or what roadblocks that you see that you might encounter or the patients might encounter. So communication style is very important with the person who is implementing the change and receiving the change. Because the person who's receiving the change, they need to be able to say, okay, this worked or this didn't work and why.
Mm. And that idea of
Mm,
transparency is so
yes,
important that
yes.
you need to be open with what's going to happen, and there's going to be a challenge to it. I think that's also being
Hmm.
not just saying what is going to happen, but also that this process is not going to be easy. It's going to be better in the long run, but at
Yes.
the moment now, it's actually going to be tough.
Oh, yeah. Growing pains. Growing pains.
That's it. Thank you very much for coming on the episode and speaking to us about this really important part of business and medicine. I appreciate it.
Yeah. Thank you for having me.